Hello, everyone. Sometimes we tend to overlook minor changes in our health without even realizing it, right? But our bodies can send us important signals, even with subtle changes. In today's video, we're going to take a close look at 13 of the most common signs of cancer. Now remember, having these symptoms does not necessarily mean you have cancer, but if your body is telling you something might be off, it's crucial to pay attention. So please make sure to watch this video until the end and don't forget to share it. Staying informed is one of the most important steps you can take for yourself and your loved ones. Let's dive in and see what our bodies are trying to tell us and how we can interpret these signals accurately. 1. Unexplained weight loss. Let's start with the first sign. Unexplained weight loss. We all want to lose a few pounds sometimes, right? But if you're losing weight without trying, say 10 pounds, around 4 to 5 kilograms, or more in just a few months, this could be a warning sign. Why? Because cancer cells can increase the body's energy consumption, leading to sudden weight loss. This is most commonly seen in pancreatic, stomach, esophageal, and lung cancers. But don't panic. Sometimes this could just be due to a metabolism change or a thyroid issue. Either way, it's best to consult your doctor. 2. Persistent fatigue. Feeling tired? We all get tired sometimes, but the kind of fatigue we're talking about here is persistent and doesn't go away no matter how much you rest. This type of exhaustion is more common in blood cancers, leukemia, colon cancer, or stomach cancer. Cancer can disrupt blood cell production, causing this constant fatigue. But before jumping to conclusions, make sure there's no other explanation. A simple blood test can be a good place to start. 3. Skin changes. Our skin is like a mirror of our health, isn't it? Unexpected changes in the skin, such as new moles or changes in the size, shape, or color of existing ones, could be a warning sign. This is particularly true for melanoma, one of the most common skin cancers. But remember, not every mole is cancerous. If you notice changes, it's worth seeing a dermatologist. Prevention is always easier than treatment. 4. Persistent cough or hoarseness. Coughing is usually caused by a cold or allergies, but a cough or hoarseness that lasts for weeks or even months could be a sign of lung or laryngeal cancer. This is especially true if you smoke. So is it just a regular cough or something more serious? The best way to find out is to consult a specialist. But remember, most of the time, these coughs are just from simple infections. 5. Difficulty swallowing or a lump in the throat. Having trouble swallowing or feeling like something's stuck in your throat all the time? If this persists for more than a few weeks, it could be a sign of esophageal, throat, or stomach cancer. But these symptoms can also be caused by reflux or a minor infection. So don't panic. If the symptoms last, it's best to get checked by a doctor. 6. Persistent pain. Pain is usually caused by simple things, but constant and persistent pain could be your body's way of telling you something's wrong. For example, bone pain could be related to bone cancer, while back pain might be linked to pancreatic or kidney cancer. The key is whether the pain is ongoing and if it has no clear cause. Not every stubborn pain means cancer, but it's wise to be cautious. 7. Slow healing sores. Do you have sores on your skin or in your mouth that just won't heal? Especially sores in the mouth, on the tongue, or gums can sometimes indicate oral cancer, especially in smokers. But simple ulcers or irritation can cause similar issues too. If a sore hasn't healed in a few weeks, consider getting it checked by a dentist or dermatologist. 8. Changes in bowel or bladder habits. Noticing any changes in your bathroom habits? Diarrhea, constipation, blood in the stool, or frequent urination could be linked to colon, prostate, or bladder cancer. But often these changes are due to digestive issues or infections. Keep an eye on the symptoms, but don't immediately assume the worst. If these signs last more than a few weeks, it's worth seeing a specialist. 9. Unexplained bleeding. Unexpected bleeding in your body. For instance, blood in your urine, stool, or when you cough. This could be a sign of certain cancers. But before panicking, notice if it's a one-time event or recurring. Many non-cancerous conditions can also cause bleeding. Women should especially pay attention to unusual bleeding outside of their menstrual cycle. Always consult a doctor. 10. Lumps or swellings. Have you found a new lump or swelling under your skin, especially in areas like the breast, testicles, or lymph nodes? These could potentially be linked to cancers developing in these regions. But not every lump is dangerous. Sometimes simple cysts can look similar. Regular self-exams and consulting your doctor if you feel something unusual is always the safest option. 11th, persistent low-grade fever or infections. Do you have a low-grade fever that just won't go away? Or do you keep getting infections? These symptoms could indicate an issue with your immune system. This is particularly true in cancers like leukemia, but frequent infections could also result from vitamin deficiencies or stress. If these symptoms persist, a detailed blood test might be useful. Remember, having these symptoms doesn't mean you have cancer. These signs are simply your body's way of telling you that something might not be right. If you notice any of these symptoms, it's always best to check with a doctor rather than assuming the worst. Staying healthy starts with listening to your body. I hope this video helps you pay more attention to your health and understand your body better. See you in the next video.